So, I'm going to talk to you about how I would incorporate the assessment of the skin, nails, and hair into a normal musculoskeletal eval. So we know that Stacia has some shoulder issues, so I'm going to go ahead and look at her. And as I look at her, the way I think about it is starting from the top down and from the middle out. And it's going to be part of the musculoskeletal exam, so the first thing I look at is always posture. And I know that as professionals we want to rush in and place our hands on people, but remembering from earlier labs that palpation is second, we start with observation and inspection. So, Stacia has some little bit of forward head, some flattening of her thoracic spine, some protraction of her shoulders, very normal responses to somebody who has a forward-centered job. So nothing that I would worry about, but I might comment on that when we start talking about shoulder intervention techniques. And then I go to the observation of her skin itself. Now, she is blue-eyed, blonde-haired, so it doesn't surprise me to see macules. And when I'm talking about the macules, we're talking about those flat, pigmented lesions. And when I say lesion, remember that it doesn't mean nasty, crusty, awful thing, but something that is different from the baseline pigment of the skin. So macules are less than 1 centimeter, what we would consider a freckle. So she has freckles or macules scattered across her body, predominantly in sun-darkened areas of her skin. That's the distribution. So the morphology would be macules, the distribution would be diffuse across the sun-darkened areas, shoulders, chest, across the bridge of the nose and the upper cheeks. This is different than the discrete nevi or moles that we can see. I'm going to bring her closer to the camera so you can see a couple of examples. Have a seat there, my dear. So this would be considered a nevi or a mole, and thinking about characteristics of malignant versus benign lesion, notice that it's nicely circumscribed, has a nice clear border, doesn't have a whole bunch of different pigments in it, and it's nice and flat. While we're here, I also want to show you a patch, or what we would call a birthmark in layman's terms. A much more irregular border, but still flat and definitely larger than 1 centimeter. Again, pretty much often a benign lesion. Now, there are some morphology characteristics that are fairly individualized, hard to categorize, and one of these I want to demonstrate. Stacia told me off camera, oh, by the way, I had a dermatologist look at this, and this is an example for the practitioner. I would not have even thought to look here on her upper back until she mentioned it. This is a peduncle, and that's different than, it is a raised lesion, but it's different than a lesion that's simply raised like a dome. It's almost like it's on a stalk, and so you can move it around. And again, tends to be benign, but it's always good to have a dermatologist look at it. We can go back over to the plinth. The teaching point is that it's a very good idea when you are looking at the exposed areas of the skin to then turn to the patient and say, are there any other areas of your skin that have been a concern, any lesions that you've noticed a change in or that you've had to see your doctor about? So that's the observation and inspection portion. Otherwise, Stacia really doesn't have anything of note. Very nice, normal morphology aside from the macules, the patch, and the 1 peduncle. So then we're going to move to the palpation of the skin. Now, when you're assessing temperature, you're going to get a better indication with the dorsum of your hand. However, that feels weird for a practitioner to come up and just put their hands like that on your shoulders. So I tend to start, as you normally would touch a patient, with your palms, but recognize that your palms do not have the same sensitivity because of the callus. I always want to look for symmetry. So I'm going to feel, and again, starting from the top down, probably the upper trapezius area onto the glenohumeral joint of the shoulder complex, and then down onto the upper arm. So I'm feeling for moisture, which would be the amount of, is it anhydrosis, is it dry, is it a normal amount of moisture, is it hyperhidrotic? She has normal moisture. And then I'm going to sense texture, which would be, is it coarse, is it very silky soft? Again, I would say her texture is normal. Then we get to temperature, and again, asymmetrical makes you think of joint infection issues, especially thinking about your postoperative orthopedic population, whereas symmetrical heat or increased temperature in the joint might make you think of osteo or rheumatoid arthritis, some more systemic disease process. So we check for temperature, and Anastasia, her temperature is fine. Then we look at turgor, and turgor is the amount of hydration inside the body as evidenced by the skin. Here's a simple little example of rebound. If I pick her skin up, and it usually works best in the forearm, just by the wrist, or on the dorsum of the hand, pick her forearm skin up and pinch it a little bit so it's not uncomfortable, and then just let it go, drops right back into place. That's normal for a young person. You can see the difference with me. I am older and have hypothyroidism, so when I pull my skin up, it takes a while for it to go back down. Not significantly. I'm not horribly, horribly ill, but it is slower than Stasia's. So that's turgor. We would also look at hair and nails, and when I observe Stasia's hair, it looks normal. You're not, I mean, yes, you can think about the kemptness and the grooming, but what you're actually thinking about is the hair and the nails as epidermal appendages of the skin, and so the story they have to tell you, the clues they give you to what may be going on inside the body that's manifested outside. So you may want to just look at her hair. Does her hair look normal? Someone who has chronic disease, you'll see very coarse or dry, often frayed hair, sometimes hair missing in patches. It just doesn't look healthy. So this hair looks and then feels healthy. You can actually feel it, but remember, always look first. And then you can look at the nails, and in your lab handouts, there are multiple examples of what you can see in changes in nails. This is a good example of normal pink coloring of the nails. Again, looking for symmetry. If one hand has very darkened or even pallorous nails and the other does not, that's something to be concerned about. In her case, that looks to me like very normal circulation. And we could even do a nail blanch test, which is not very scientific, but it's a quick and dirty way to look at how quickly does the body restore circulation. If it's taken away from an area, you would expect within a second or two for that color to come back. That's the basic skin, hair, and nails exam. Thank you.